So what does ADHD do to a person?
Good question.
Hi, I'm Amy Norris-Brilliant, and I am the director of the Division of ADHD, Learning Disabilities and Related Disorders. I also direct the Pediatric Neuropsychology Center here at Mount Sinai.
Hi, I'm Maria Edman. I am a clinical psychologist, and I work in the Division of ADHD, Learning Disabilities and Related Disorders with Dr. Norris-Brilliant, and also am the director of psychology at Student and Trainee Mental Health program at Mount Sinai. We're here to talk about the most searched terms about ADHD from Google. Shall we get started?
Yes, let's do it. You want to hold and I'll peel?
That sounds great.
ADHD can do many things to children and adolescents. The first and most important thing that families need to know is it can take them a very long time to get ready in the morning. Getting to the point where you're ready to get out the door, getting dressed, eating breakfast, making sure the bag is packed can be really challenging. As kids get older, they move to adolescence and they're meant to be doing their homework on their own, figuring out how to get from point A to point B, figuring out when do I need to do this so that it can be ready at the right time. Those planning things can be really hard. The other two pieces are emotional regulation. So children and adolescents with ADHD have a hard time kind of keeping their cool and not making small things into big things. Finally, there's something called cognitive flexibility. For kids with ADHD, when their first plan doesn't work out or something doesn't go as expected, it can be really hard to pivot and come up with a plan B or to roll with the punches.
And I always think about like the child within the adult when I am working with an adult, because they didn't emerge out of nowhere with their particular concerns. And so, sometimes adults have been diagnosed in childhood and sometimes they haven't been. But in any case, those same problems of organization and planning plague adults with ADHD too, but now they're planning to finish their work on time. They're also planning for potential relationships with spouses and for managing children, which is a lot more complicated. And so things can go wrong in all of those areas. It's just like emotion regulation for kids, emotion regulation for adults can be difficult and can interfere with relationships, with peers, with colleagues, with friends, with spouses, and with children. Coming up next, can you overcome ADHD? It's generally thought that there's a certain percentage of people who have ADHD in childhood, but then it remits in adulthood. More recent research has found that ADHD symptoms tend to ebb and flow throughout the lifespan. So what looks like it may be disappeared just shows up in a new form when the demands, cognitive demands, organizational demands increase, and you might see those symptoms pop up again in later life. There's not a lot of research, but the research that exists looks at adults who seem to have overcome ADHD as just really managing their symptoms so well that they seem invisible. You want to peel the next one, Amy?
I do.
I know how you like to. They're so satisfying.
I know. Okay. Why are so many more people being diagnosed with ADHD? This is a really good question.
I think you should talk about assessment, because I think that's what the answer is.
So there are a lot more folks recognizing that they might have issues. And some of this comes from teachers kind of knowing the coded ways to tell parents to go get an assessment. Some of it comes from parents being aware of their own challenges. And some of it comes from a lot of folks watching TikTok or looking on Reddit and saying, oh, I identify with that. And so a lot more people are just coming in for assessment. When we were growing up, you only got assessed if you were disruptive.
There's also a lot of conversation about whether social media is impacting the increased diagnoses of ADHD. From my understanding, because ADHD is a neurodevelopmental disorder and it's highly heritable. It's about 78% heritable. That means most of the predisposition for ADHD comes from the genes. And the environmental risk factors that we know impact the development of ADHD the most are in the pre and perinatal periods. So things like toxins during pregnancy or at birth, brain injury at birth, and a lot of those early experiences contribute to the development of ADHD symptoms. We don't have enough research to suggest that social media creates ADHD, certainly by itself.
Right. The only thing we can say is that we do like our families to follow all of the recommendations from the American Academy of Pediatricians around social media, exposure to iPads and screen time. That's really important for a lot of reasons. But that said, there's not enough research right now to show that that impacts anything having to do with ADHD. I will let you peel the next one.
Oh, all right. Okay. Do I have ADHD or am I just lazy? Oh, that's so sad, right?
I know. I don't think that anyone chooses to be lazy, personally.
There are all misconceptions in society before we knew too much about ADHD that children who were exhibiting those symptoms were just being lazy. But we know now a lot more about how ADHD impacts the brain and how, for example, it makes it more difficult for a child to finish their homework in the same amount of time as another child. It's not because they're being lazy. It's because maybe they're processing things a little bit slower or they're getting distracted more often.
The other thing to note is that if you're watching this video and you are feeling like you are really lazy, you cannot force yourself to do work, you cannot get through your day, there are many reasons besides ADHD that could have you feeling that way. So it's really important to go to a qualified professional to get an assessment. So now, do the next one. Does ADHD make you depressed?
You know, now that you're talking more about that, Amy, it seems like these two questions could be related in that if you're watching this video, you might notice symptoms in yourself like laziness or difficulty getting out of bed, not being interested in things. And they could be for more than one reason. If, for example, you do have depression, and certainly you'd want to go to a mental health professional to identify that. You also might have co-occurring ADHD, or you may not. And so while ADHD does not make a person depressed, ADHD often co-occurs with a lot of other conditions like depression, anxiety, learning disabilities, and so on.
You know plenty of people with ADHD who are not depressed. And I want to emphasize again, this is not some sort of life sentence where you are doomed if you have ADHD. Plenty of people are happy, healthy, and productive with their ADHD. It's just learning to manage it.
You want to peel, Amy?
I'll peel.
Okay.
How can ADHD go undetected for years? This is a great question because this is something that comes up a lot. We get many teenagers, college students, and even medical students here who did not get diagnosed with ADHD until they were a little bit older. And this is a question that their parents ask all the time. One thing that we talk about is, were there signs before now? And when you kind of look back in the history, there usually were some signs, but oftentimes people are smart enough, savvy enough, sophisticated enough that they're able to hide or compensate for the symptoms of ADHD until their work gets to be too hard or the amount of work gets to be too much and they can't manage it themselves anymore. And so they get picked up a little later, but when you look back at it and they say, oh, you know, when I was 5, I used to temper tantrum a lot. Or when I was 7, my parents enrolled me in ballet daily so that I could get the wiggles out. So those are the kinds of things that we ask about.
And they always do. If they meet criteria for ADHD, there are always symptoms before the age of 12. But like Amy is saying, sometimes the child is so capable in every other way that those symptoms go unnoticed, or they don't have so much of an impact on the child's life that it's worth it for the family to do anything about it. All right. All right, Amy, how can I manage ADHD as an adult in my work and personal life?
Oh man, well, I think that's one for you.
So I tell adults with ADHD that recommended treatment for ADHD is a combination of medication management and what's called cognitive behavioral therapy for adult ADHD. And the medication part, you should consult with your psychiatrist about what is best for you, and it might be a process of finding the right thing at the right dose. And the medication is still the first line treatment for ADHD, meaning it has the most research on its effectiveness, and it treats the core symptoms of hyperactivity, impulsivity, and inattention. And the cognitive behavioral therapy for adult ADHD is kind of like a second line treatment. And what that does is it helps the person think about how they want to organize their own lives, put plans into place, make priorities, and it really helps them take all of those cognitive abilities from their medication and put them to use in a way that they want to live their life. And that can work very well.
What are typical adult ADHD symptoms beyond hyperactivity? I'll name 2 and then I'll let you do the rest.
Okay.
1, showing up late for all of your work and social engagements. 2, forgetting about important family and friend dates like birthdays, anniversaries, being prepared for all of the fun things in life.
Yeah. In fact, hyperactivity is, I don't even see it that much in adults. It's more often that we see the inattentive type. But you do see hyperactivity in adults with fidgeting, people who can't sit still. They need to always be holding something or fiddling with something. That's hyperactivity. They can't sit still through a whole meeting. Often you see them go on their cell phone, which other people do, but they might do more often. But certainly there are plenty of other symptoms. Inattention also can look like being in the middle of a conversation and not really listening to the person you're talking to. And that can get in the way in one-on-one and in group settings. It can have a person not know what's going on in terms of a group. And adults with ADHD many times complain to me that the friendships that they once had, they haven't been able to keep in touch, mostly because they forget to text message their friends back. And that is related to inattention and distractibility. So there are certainly social implications for that, but certainly at work and in family life as well.
And one of the things we see a lot with medical and legal professionals is they'll say, I have to read something multiple times before I can understand it. And it's not that their reading comprehension is off, it's just being able to be focused enough to read for dense material for long periods of time. That can be another challenge related to inattention. Okay, so last peel. This one is all you.
It's gonna be me, all right?
Yeah.
Do you have a good answer for this, Amy? What is rejection sensitivity when it comes to ADHD?
I actually have not heard of any research involving rejection sensitivity and ADHD together. I don't know if this is just one of those internet things that has caught hold.
So I looked it up recently just out of curiosity, and apparently they are starting to do a little bit of research on this, but they haven't found a strong enough correlation that we can say that this is part of ADHD. It's certainly not part of the diagnosis or core symptoms, but people are talking about it on the internet. My sense is it's something about the combination of emotion regulation difficulties and past failures. Certainly for adults who have ADHD that was never diagnosed or treated, they have a lot of past failures in school and in relationships. And so those past failures can sometimes trigger more intense emotions with new perceived failures. So I imagine it's something related to that, but certainly a lot more research to be done on that one.
And those are the top 10 questions about ADHD on Google.
If you think you might have symptoms of ADHD, we do recommend you see a mental health professional to get a good assessment. And that's it.